caffeine is an extremely popular stimulant, as it stimulates the brain and nervous system. It also increases the circulation of chemicals in the body, such as cortisol and adrenaline. Caffeine can be found naturally in the leaves and fruits of some plants. It's found in coffee, black and green tea, cocoa, soft drinks, and energy drinks. It may also be found in chocolate bars, energy bars, and some over-the-counter medications. In small doses, caffeine can make you feel refreshed and focused. Moderate caffeine consumption, defined as 300 to 400 milligrams of caffeine per day, or about 3 to 4 cups of coffee, can provide some clear benefits, especially for people who need help with alertness and concentration. Caffeine may have a positive effect on people who have ADHD. Caffeine appears to work similarly to the ADHD drug Adderall in increasing the ability to focus and concentrate due to it being a stimulant, as it increases brain activity and constricts blood vessels in the brain. According to research studies, moderate caffeine consumption, equivalent to 2 to 6 cups of coffee per day, may have a protective effect for people who are prone to depression. The time of consumption has an impact on mood effects, with the most noticeable effects appearing in the late morning. In fact, one study suggested that caffeine could be used as a nutritional supplement for older adults, improving mood and cognitive performance in daily living tasks. Research has suggested that a moderate daily caffeine intake may reduce the risk of developing Parkinson's disease and Alzheimer's disease. Some research also indicates that people who drink coffee regularly have a lower risk of heart disease and stroke. However, because the results were not associated with other caffeinated beverages, ingredients other than caffeine in coffee may provide protection. Caffeine increases alertness by blocking a brain chemical known as adenosine that causes tiredness, while also triggering the release of adrenaline, which is known to increase energy. Caffeine-induced anxiety occurs when the amount of caffeine consumed is sufficiently high. While caffeine has some natural benefits, high doses have been shown to cause anxiety symptoms, especially in people with panic disorders and social anxiety disorder. For people with serious mental illnesses, the potential risks of caffeine consumption may outweigh the potential benefits. These individuals who consume excessive amounts of caffeine may experience symptoms associated with increased hostility and even psychotic symptoms. Caffeine in high doses may lead people to have difficulty sleeping. Even small amounts of caffeine consumption too close to bedtime can disrupt the sleep-wake cycle. The potential sleep disruptions caused by caffeine and its stimulant effects can cause rapid hypomania or mania, which are mood episodes characterized by high energy, racing thoughts, and impulsive behaviors. Caffeine consumption should generally be avoided by people suffering from bipolar disorder. A consistent sleep schedule that includes around 8 hours of continuous sleep per night is an important lifestyle plan for people with major depression or bipolar disorder to help prevent depressive or manic episodes. Even in people who do not have a mood disorder, a few nights of insomnia caused by caffeine use can cause mood effects such as sadness or fatigue. Caffeine is easily absorbed by the body, and the short-term effects are typically felt between 5 and 30 minutes after consumption. These effects can include increased breathing and heart rate, as well as increased mental and physical alertness and energy. These effects can last up to 12 hours depending on the individual. Some of the signs and symptoms of excessive caffeine consumption include a rise in body temperature, frequent urination, dehydration, dizziness and headaches, rapid heartbeat, restlessness and excitability, irritability, trembling hands, feeling energetic, followed by an even greater feeling of tiredness. Like many other drugs, people who drink caffeine can develop a tolerance. They become so used to its effects on their body that they require higher doses to achieve the same effects as before. Over time, they may feel physically and psychologically dependent on caffeine. If you're accustomed to regularly consuming caffeine and then abruptly stop, you may experience withdrawal symptoms, such as headaches, anxiety, fatigue, depressed mood, difficulty concentrating, tremors, and irritability. Jerry Seinfeld has said, "We want to do a lot of stuff. We're not in great shape. We didn't get a good night's sleep. We're a little depressed." Coffee solves all these problems in one delightful little cup. Thanks for watching, and see you next time.